territory. It is a pleasure to bring this FNHMA virtual town hall to you. Our apologies for running a little bit on Indian time. Um, we are working through that right now. So I do want to tell you what's happening today. But first, thank you all so much for welcoming us into your territories, wherever you are listening or watching from. It is a pleasure and a humble privilege to join you every Thursday, and we will continue to do so until June the 25th. A special thank you to Indigenous Health Today, that's ihtoday.ca, the team at Nation Talk, of course, APTN. Thank you so much for your support every week in getting the messages out. And we'll do a formal thank you to everybody tuning in on those radio stations as well. We have a couple of folks that are going to be talking about COVID-19 and the responses today. We're welcoming back from Indigenous Services Canada, Dr. Tom Wong, who is no stranger to all of our viewers and listeners. And joining us from BC is the president, Mr. Keith Marshall, longtime friend of FNHMA. He's the president of the BC First Nation Health Directors Association, and he is a health director as well from Bella Bella. So I can't wait to hear what's happening in BC. As you know, they have their own health authority. It's been transferred to First Nation control. So we always look forward to the insight, innovation, and how things are run from their perspective. So with that, I'm going to ask Dr. Tom Wong to give us the update from Indigenous Services Canada. Dr. Tom Wong, welcome again to the FNHMA Town Hall.
Well, thank you very much, Marianne. And good afternoon or good morning, everyone. I want to acknowledge that today I'm on the unceded Algonquin territories. You have in front of you, together with this talk, some slides, and perhaps we can look at slide number 2. Before the slide comes on the screen, perhaps I just want to give some context. Indigenous Services Canada get information about new cases of COVID for First Nations on reserve in the provinces. However, for First Nations off reserve and for Métis and for Inuit, it's something that we are hearing our Indigenous partners really need the help of provinces and territories in order to collect and provide that information to them so that it could help them to prepare and respond to COVID-19. With that, the next set of slides, I'll be actually walking us through some of the key features of what we know about First Nations on reserve COVID cases. As of June 9th, there's been close to 100,000 cases being reported in Canada for all Canadians, and close to 8,000 deaths. Now, this compares to, for First Nations on reserve thus far, 237 cases reported, as well as 22 hospitalization cases and 6 deaths. Now, how does that compare, to, the population? So if we look at the next slide, slide number 3, we see that, in Canada, that translates, into the Canadian rate, overall rate, is about 5 times the attack rate in First Nations on reserve. For COVID-related deaths, there's been, as I said before, close to 8,000 deaths all over Canada. And there's been 6 deaths in First Nations on reserve. That translates, into the Canadian overall rate is about 17 times that of First Nations on reserve in provinces cases. With that, let's turn to the next slide. So what you are seeing as a picture is that thus far, we've been seeing that First Nations, the attack rate for First Nations on reserve compared to the general Canadian rate, it's been much lower. The hospitalization rate much lower, and the case fatality or mortality rate also much lower. And all of that, the credit goes to First Nations community leaders who's been very decisive, take decisive actions in shutting this virus out from their communities. And if they do get into the communities, they're able to contain it and contain the outbreak. And with that, there's been support, from Indigenous Services Canada and other local health departments to support those efforts. And with the reopening of the economy, it is very important that we have to take things very cautiously and go gradually and be very careful and observe, infections, outbreaks around us, around in the community, so that those outbreaks don't spill over on reserve in First Nations communities or into Métis community or Inuit communities. So when we look at the slide number 4, what you are seeing here, is the total number of reported COVID-19 cases among First Nations communities in the provinces. And you see those cumulative cases. In front of you, you see, the red line. That is, how the cumulative cases have been flattening out. And you've been seeing, the flattening of the curve has been over the past month and a half now. Also, when you look at the green line is the recovery cases. You see that at this moment, the recovery cases are improving and improving day after day. And right now, the recovery rate is close to 90% of all of the cases, First Nations cases on reserve. So if we turn to the next slide number 5, some people ask, well, that's the national rate, but what about for First Nations on reserve? What about in each region? So Quebec, Ontario, BC, et cetera, et cetera. You can see in front of you the different color lines. So you can see that for most regions for First Nations on reserve, the curve have been flattening. They've been flattened for many, many weeks. Right now, the area, where there's some recent activities, is in Alberta. You can see that, the yellow line, there's been, some increases in Alberta. However, even with that, there may be, a trend at this moment. The increase may be also slowing down in Alberta. And I think that what that means is that when a community, when public health department see a phenomenon like that, it is so important because we are all in the same boat together, and we want to actually try to see what we can do together with all the public health measures to try to calm down the virus and slow down the virus, so that the curve would be flattened and the curve would be bent. So if we actually look at the next slide number 6. Slide number 6, is a slide depicting the new cases, from each region. And as I said before, all the other regions, the new cases, have gone down to 0 or 1 case per week, and it's been for weeks like that, except in Alberta, where there's been over the past week, there's been 13 new cases in 2 communities. So that says to us that we need to redouble the effort in the places where there is, some spread of the infection there. But I am confident that together we can stop this virus. So let's look at the next slide number 7. This is a slide depicting age group on the y-axis. and it's subdivided, into male versus female. As we can see, female cases tend to be a bit younger than the male cases. But in general, we've been seeing about 50-50, about a similar proportion of male cases when compared to female cases. And thus far, for First Nations on reserve, we've been seeing more young people, children and youth reported cases compared to the general Canadian cases. So the general Canadian cases, approximately about 6 to 7% of the cases, were in children and youth. But for First Nations on reserve thus far, there's been between 20 to 25%. And part of that has to do, with young people, really, really are being loved very much by communities and by family, by extended family, by different households. And they go and visit their aunties, their uncles, their grandparents, their cousins. So it is very important to be able to actually do the visiting, but it is also equally important to be able to do it with physical distancing, wash their hands, and not sharing food, have their own food. I know it's hard, but if we do that, we can surely be able to keep the infection spread to a minimum. So let's look at the next slide number 8, which is a slide on the personal protective equipment, like a mask or gloves or gowns or face coverings, face shields. As you can see here, since the middle of February, Indigenous Services Canada had many requests and have shipped close to 1,000 orders of PPEs across Canada to many, many First Nations communities. And we'll continue to do that, and we'll continue to do more when there's additional requests. And those requests, are for healthcare workers, for family care workers, for long-term care facilities, and for police working on reserve. It is so important that First Nations on reserve and First Nations off reserve, and for Métis and Inuit, they are all protected, by physical distancing, by hand washing, by respiratory hygiene, by all of the PPEs. So with that, I'm going to stop, and I want to actually say miigwech, nakumik, merci, and thank you. Merci. And over back to you, Marian.
Thank you so much, Dr. Wong, for the information. I know our radio listeners were happy to have you explain the slides so that they could understand what was happening here as well, because we know that we didn't have an opportunity to see those when we have the radio listeners. So thank you, Dr. Wong, for walking us through the information. We're going to come back to you with some questions from the inbox. You know how the town hall goes, so we appreciate you staying with us. And I do see there is a question for you already. I do want to remind everyone, speaking about questions, that if you do have a question, please make sure to send that in to us. That email address for questions is fnhma@ihtoday.ca, and we'll try to get those on today. If not, we'll come back to them if our panelists have not already covered the information that you're asking about. Another note, stay tuned to the very end after the Q&A. I have such a special announcement to make that you don't want to miss. Now, again, fnhma@ihtoday.ca for those questions. And I'm watching the weather here in unceded Algonquin territory, and I hope that we can get through this hour without any technical issues on my end or our production side. We've already had a problem with my connection, so I apologize again for the delay. That's me bad. I am working diligently to get us through the rest of the program. Okay, we have joining us longtime friend, as I mentioned, of FNHMA, and it is President of the BC First Nation Health Directors Association, Health Director, and Mr. Keith Marshall. Keith, welcome to the FNHMA Town Hall.
Thank you, Mary. Can everybody hear me?
We can hear you, Keith.
Good. I apologize. We couldn't get video today. For some reason, I'm having glitches with I have two machines going, but anyway, I can see you, but you can't see me. So unfortunately, or maybe fortunately, I'm not sure. Hello, and thank you for all inviting me to participate in today's town hall meeting as a guest. I would like to begin by acknowledging the First Nation traditional territories on which we are collectively gathered. I am currently sitting on the unceded territory of the Heiltsuk people in Bella Bella, British Columbia. My name is Keith Marshall. I am the president of the First Nations Health Director Association, and I also serve as one of 3 regional board representatives for the Vancouver Coastal region. My job again is the Director of Community Health Program at the Heiltsuk Health Center Society here in Bella Bella. A place so nice they named it twice, and that is true. If you ever get a chance to visit, you can see what I'm talking about. Just a little bit about our association. We're made up of health directors across the province of British Columbia. We have 5 regions in British Columbia, and each region provides 3 representatives to sit on the board of directors representing the province. Of the 2, we have 203 First Nations and 150 health directors that represent the First Nations across BC. Some health directors, like myself, represent one community. Other health directors represent several communities or nations. So our work is very diverse. We have different cultural and linguistic groups. So to keep the attention to the culture of all the communities and all groups seems a challenge at times, but I think we do a good job at it. Our association, which is made up of our 15 members, we are one of the 3 pillars of the First Nations Health Services in BC, which is made up of the First Nations Health Council, the First Nations Health Authority, and the First Nations Health Director Association. We also have an affiliation with the Tripartite Committee on First Nations Health, which is made up of federal and provincial representatives that we meet to discuss health issues in British Columbia. In 2013, BC moved away from receiving services from First Nations Health Inuit Health Branch and formed the First Nations Health Authority. From that time, we've been transforming our programs and our processes to better serve First Nations communities in BC. Our Health Directors Association, we are the technical advisors to the First Nations Health Authority and to the First Nations Health Council. And what that means, I'll give you an example. So when the transfer was done, one of the things that we had to do, because we were very connected to First Nations and Inuit Health Branch, we made a transition in our pharmacy program so that we moved from NIHB to a provincial carrier, which is Provincial Blue Cross. Now, with that, of course, there were some major changes that we had to make with respect to the dispensing of drugs, and there was a huge issue between whether or not our members could continue to receive brand name drugs with respect to generic drugs. So one of the examples that we had to do as the health directors in working with our communities and with our sub-regions and with our region was the issue of, as you know, that under NIHB, any First Nation person who is traveling anywhere in Canada could go to any pharmacy and get the prescription filled based on the criteria had followed. Because we have gone to a provincial carrier, First Nation communities in BC can no longer do that because they don't fall under the NIHB umbrella anymore. So that we had to work, though, to ensure that even within our community members who are traveling out of province had sufficient prescriptions to ensure that they wouldn't run out, because had they needed to go to a pharmacy outside of the province, they would have to pay out of their own pocket. So there were anomalies like that. When we met with FNHA with respect to having this conversation around the transformation for pharmacy and pharmacare, it was a very complex process that we went through, but our association, in support of our health directors, were able to ensure that the services were continuing at least at the same, and in many cases at a higher level than what they were currently receiving. So that's just one of the examples that we do as technical advisors to our partners. We meet on a quarterly basis with our partner to do strategic planning to ensure that the changes that are required in delivery of services to First Nation communities are brought forth and recognized by the health authority. The Health Council, of course, is a political arm, and we work closely with them to ensure that the chiefs and other leaders are fully informed of the processes and the changes that we go through on a regular basis. So we are now currently in week 9 of the First Nations Health Authority Emergency Response Level 3. We at the FNHA have been hosting bi-weekly town hall meetings for all health directors in British Columbia with the First Nation Health Authority, which they provide updates on COVID-19 response and support available to communities, and health directors have an opportunity to pose questions to the FNHA leadership. These meetings have been proved very resourceful for our communities because we have so many communities that are rural and remote that don't have connectivity and don't have the level of service that other communities have. So we need to ensure that we're doing our best that nobody is left behind with respect to health services. One of the programs that has been implemented in BC is a virtual doctor. So communities that don't have the health professionals in community have the opportunity to use this mechanism to help them to get the information that they need to ensure their community members are safe. So we've been that's been one of the really good positive things that have happened with respect to COVID-19. COVID-19, of course, has really shut down our communities. We're very pleased to see that our numbers for COVID is very low in DC, and many communities have had no cases, but are still following the protocols that have been set down by our respective chiefs and councils and leaders with respect to social distancing, self-isolation, and not having people come in the community that aren't from the community. Now, you can imagine this is an island that is 14 kilometers long. So those of you that can drive to other places in Ontario, we don't have the luxury. After 14 kilometers, we hit water. So it's some of us, I think, that have been in community for the past 3 months are hoping that there's going to be some lifting of restrictions in the near future, so we can go get out of the community and see more of the country. One of the things that we are currently doing with respect to COVID-19, we have developed Made in BC First Nations the certification program. One of the modules in that program dealt with pandemic plans and so on and so forth. So one of the questions that came up from many of our First Nations health director is that they're not prepared in emergency preparedness planning because it hasn't been something that prior to COVID that was on the front burner. So in one of our modules, we did cover that issue with respect to communicable disease emergency planning, and we have developed a micro course on communicable disease, and we're going to be offering that to our health directors that will support them in developing, activating, implementing, and deactivating a communicable disease emergency plan. We find that it's something that the communities really need in their in supporting themselves to do the work that they need to do in communities. And we have the specialists coming in to teach that course. We're just working on the logistics as to some of it has to be done online in communities. So we're really excited about that occurring because, as I say, it's very important that we do this. A significant focus as far as a Health Director Association and as the First Nations Health Authority and Council has been supporting the health and wellness of our health directors during this time. We encourage health directors to practice what we call our First Nations Health Director Association head-to-heart tips for self-care, and that made up 3 components: honoring the land, powering down, and weaving a network of support to take care of mind, body, and spirit. As we know, sometimes even in our regular lives, we don't take the time for ourselves to respect ourselves in taking the time for ourselves. We're always usually busy dealing with trauma, dealing with crisis, and just dealing with the day-to-day work that happens in our communities with respect to what health directors have to do on a daily basis. So we really promote the Head to Heart campaign tips for self-care, and we continue to mention that in any of our meetings that we have to ensure that we really, try to have health directors take time for themselves because we feel that's very important. In addition, as part of our Head to Heart campaign, the FNHDA is providing emotional and cultural support that is available to health directors and their teams, and these services are available 7 days a week through one of our communities, through the Sultan Society, and also the Kakamin Family Development Center. And they're available by phone and by video, and they have recently offered to provide these services to health directors and others who are really struggling and are finding this COVID-19 very overwhelming, and to ensure that not only health directors but their community members as well can participate with these very knowledgeable and well-versed healers that take the time, and they have the time and the patience to do this one-on-one work with individuals in any community that may ask for their services. And we continue to promote that because sometimes we get into these mindsets where it's just go, and I say we don't take the time, or we have community members who are struggling. So it's important that we continue to promote the emotional and cultural supports for health directors and teams and community members. We're looking forward and moving forward. We'll be looking forward to our BC Restart Plan to gradually reduce limitations to reopen during the pandemic and the pathways of safe reopening of First Nations community. We understand the importance of social distancing, self-isolation, and taking those precautions to ensure that COVID doesn't grasp the communities, and because, as I say, many of our communities have no cases, which is we're really pleased. I know sometimes it's hard on people not to be able to visit family and friends, especially elders who will want to visit their grandchildren, and and other family members, it's very difficult. But however, we understand that in order for us to continue to remain healthy, these are the steps that we are required to take going forward with addressing the issues around COVID. We are in the process now, working with the First Nations Health Authority, that we are revising and upgrading our medical transportation program. That, of course, is we know what kind of difficulties medical transportation has, not only in BC, but right across the country. And we're trying our best to work with the First Nations Health Authority to do a complete overhaul of our medical transportation program, because it's so unique in this province, because we have different needs in different areas. We have some communities who have very small patient travel or medical transportation budgets, and others budgets that are quite high because of the remoteness of their communities and the requirement to travel out of community to seek the medical supports that they need. Some communities have what we call CHRs or personal care attendants, and are struggling to find nurses, LPNs, and other medical specialists that are needed in the community. So medical transportation is a huge issue in BC, and we have started our communication and our dialogue with the First Nations Health Authority and the Medical Transportation Branch, and we're looking forward to this work. If we look back on the work that we did with pharmacare and the work that we did with medical supplies and equipment and other major projects that we worked on with First Nations Health Authority, we've been able to come up with some really very, very, very good plans and policies and processes that have very much improved the delivery of services to our First Nation community. So this is another step that we're looking forward to over the next several months to review, revise, rewrite, and implement a new medical transportation program. We can, as we say, it's a time in our lives where we have to understand that there's a new normal. There's a new normal in how we will go about our business after COVID is finished. And I know this is kind of off topic, but it'll be a new normal with respect to what's happening in the U.S. And it was, I always say, I was asked yesterday what I speak before, what I was thankful for, and I said peaceful protests, because we as First Nations, African Canadians are going through some difficult times, and I'm really, for the first time, I see some hope that things may change. So I just say that as a sidebar. In closing, I appreciate how challenging our current reality is for health leads working on the ground in communities, and we are here to support them in the best way we can and to continue to do this good work. I really want to acknowledge, Marian and I have been at this probably for about 9 years now. And we had many great good meetings, and shared some great information, and we want to continue our good working relationship and to strengthen our working relationship with both organizations to ensure that we work for the communities that we have taken on this challenge for, whether it's in Newfoundland and Labrador or in the remote communities of BC right across the country. So on behalf of our association, I would like to thank the FNHMA for inviting me to participate in today's town hall meeting. It's been valuable to hear all the perspectives shared by health leads across the country. And as I say, I hope we continue this good work, and so that we continue to strengthen our communities across the country. Thank you.
Thank you so much, Keith, for joining us on this virtual town hall. I love that you brought forward the point of the landscape outside of COVID that's happening here and in the US. And that's a perfect reminder that June is Indigenous Peoples History Month. So please look at the resources, the online celebrations that are happening. I know here in Ottawa, there's a marketplace where you can buy from Indigenous vendors and continue to support the economy in which they thrive. And if you are looking for PPE equipment, be sure to buy Indigenous and look at all of the great, innovative, and successful entrepreneurs who have responded by converting maple syrup factories into hand sanitization responses, and just support the local economy in that way when you're refreshing your PPE supplies. A reminder, we do have a moment or two for a couple of quick questions. So if you want to send those in, you can do so at ihtoday.ca. Thank you once again to all of our Facebook watchers as well, specifically Angela, Darlene, Yvonne, Jordan, and Cynthia. I'm so glad that you are watching on the FNHMA Facebook channel, and we appreciate your support. We still have a special announcement coming. But first, I would like to go over to Dr. Tom Wong. Dr. Wong, we do have a question in the inbox for you, and there's two parts to this question. We recognize too that if you need to share some information in a future town hall in response, just let us know and we'll be sure to come back to the topic. So, Dr. Wong, we're going to go back to PPE, and we understand that the recommendations regarding face masks has changed, and that it is now recommended that everybody wear a mask, especially when social distancing is a challenge. Are those part of the federal government response now in terms of supporting our nations with non-medical masks for the general population? And is that, if so, is it on and off reserve, Dr. Wong?
Yeah, thank you very much, for the question. As science and evidence evolve, there's newer evidence, that additional protection by wearing masks can be beneficial. And at Indigenous Services Canada, we are very eager to work with First Nations communities to support, the provision of PPE such as masks, so that members can protect themselves from catching the COVID virus. And also, if they happen to actually have the virus, it also prevents them, from spreading to another person. So this is something that, we are very eager to support. As for off-reserve, First Nations off-reserve, the provinces and territories provide PPEs for everyone in their particular province. So, that would be the first place to go. However, if for some reason, because of a temporary shortage, of that particular province, please right away contact our regional office. Our regional office has a coordinator specifically for PPE, and they will make sure that your needs are met in that urgent situation. Thank you.
Thank you, Dr. Wong, and don't go away just quite yet. We appreciate that you are directing folks to the regional offices. Again, just a reminder, pick up the phone, call those regional offices of Indigenous Services Canada, First Nations, and Inuit Health Branch if you are having problems accessing, and they're there to support. We appreciate this partnership, Dr. Wong. Let's move over to a question with respect to testing. We know that people are encouraged in mainstream to get tested if they feel they've been compromised or exposed, or feel that they have the symptoms. Can you share with us, if you know what the level of testing happening in First Nations is comparatively to our non-Indigenous communities?
Yeah, perhaps one of the really exciting things that's been happening across Canada is because of the importance, in addition to many public health measures. One of them, is targeted and smart testing. And a number of First Nations organizations have been able to use data linkages, working with the provincial system, laboratory system, and able to come up with estimates, of testing in First Nations, both on reserve as well as off reserve. And from those initiatives, what they have found thus far in some parts of the country is that the testing uptake rate, compare, to their provincial population uptake rate for testing, is actually higher in First Nations. So despite the increased testing, the higher rate of testing in First Nations, both on and off reserve, what in those communities and those regions, what they're seeing is that the actual number of positive cases, the attack rate for First Nations is actually lower than the general population of that particular province or that particular jurisdiction. And that's very comforting to know that, there's some evidence in some parts of the country where there's the uptake on testing is actually high in First Nations, and yet the attack rate for COVID is actually lower than the general Canadian population in that particular jurisdiction.
Thanks again, Dr. Wong. I'm going to move over to Keith. Keith, thank you so much again for joining us. And as you mentioned, we are so excited and thrilled to be striving towards our strengthened partnership, supporting our nations from coast to coast. And we look forward to further supporting each other as organizations in the future. We're so happy that you were able to join us today. Keith, you live in one of the most beautiful nations, and that is beautiful Bella. Bella, like you said, it's double named for its beauty. BC has been exercising its sovereignty with relationship to closing the territories to protect our communities. When can we come visit Bella Bella? Is this still being enforced in terms of closure to the public? And what does that look like for BC and your sovereignty exercises, Keith?
So, with respect to Bella Bella itself, we are still under what we call lockdown. We still don't allow any non-residents to come to Bella Bella. Any residents that do go out are required to quarantine for 14 days until such time we the HEMAs, which are the hereditary chiefs, and the elected council and senior representative meet on a weekly basis to review the situation. Considering that we have all commercial flights and everything have been canceled, the ferry runs, but with mostly to bring in supplies to the community. But we're hoping that over the next few weeks, we continue to, as I say, we continue to reevaluate each week. And as we see other parts of the province opening and watching what the trend is with respect to COVID cases, if it continues to stay as it is and not to increase too much, then I think that we will start to open our doors again. Because we're rural and remote, there are a lot of services that we normally bring into the community, specialists that cannot come in. So, you know, we understand we have to manage that because it's having an effect on our community members. So we're trying to see how we can address those issues and bring in some of our health professionals to provide those services that they provided before COVID. So it's just monitoring it on a regular basis to see how things are. And we're hoping by the end of June into July, we can start being changing the conditions to allow our community to reopen again.
Thanks to the production team who have reminded me to unmute myself. The world of technology, how many times do you hear that in a day? You see somebody's lips moving and can't hear them. Well, I have fallen prey to the same thing as you. So to recap, that was me asking Keith, when will Bella Bella, the beautiful territory, be open to outside visitors? Because the province has been very diligent, and the nations in the province, about exercising their sovereignty and closing the borders. So that was Keith's response. And again, thank you, Keith. What the viewers and our listeners didn't hear is my re-emphasis in our continued and reciprocal enthusiasm around supporting each other as organizations to lift up all of our health directors, health line workers, and frontline service folks across Turtle Island. I do want to give a couple of things out in terms of an announcements. So there is a question with respect to urban First Nations in the inbox. I would say to that person, you should stay tuned for next week. Next week on the FNHMA Town Hall, we are going to welcome President of the National Association of Friendship Centers, Jocelyn Forsma. We're really keen to have her speak, as we know there are a number of questions with respect to urban populations, and those are the folks that our friendship centers serve. We are so grateful for the friendship centers who have been stepping up, providing the services that need to be provided, implementing access to all sorts of extenuating circumstances. So stay tuned next week as we have a great dialogue with Jocelyn. We are going to invite back our partners from Indigenous Services Canada again to provide the latest update on what's happening with respect to COVID-19 and the response from Indigenous Services Canada. We will also be welcoming back the lovely best ladies, and that is Carol Hopkins of the Thunderbird Partnership Foundation, Dr. Brenda Rastool from the First Peoples Wellness Circle. We're going to have and unpack with Jocelyn the issues surrounding homelessness, transient members who go from nation to city and some of the challenges that have been happening with that. And of course, a focus on our mental wellness. I love what Keith said earlier about head to heart. And that is so touching. And I want to remind the folks, make sure you take care, continue to demonstrate self-care during these times. And we want to continue supporting and recognizing all of you who are working so diligently. I know that we're chatting with Indigenous Health Today, that's ihtoday.ca, regarding them continuing the town halls. FNHMA will be taking a pause as of, we'll have the June 25th town hall and then we'll take a pause, but we think IHT is a perfect partner to continue a monthly dialogue. So stay tuned as we explore more of that. We also want to get in a special announcement. I've been talking about this with media and hinting at it for this whole town hall. Mark your dates, mark your calendars, folks. Mark November 4th in your calendar. Mark it down now. This is something you do not want to miss. Many organizations, many associations have postponed or canceled their national conferences. Here at FNHMA, we recognize that you can't postpone, you can't cancel. You are the heart of our nations. You keep us well, you protect us. And on November 4th, we are celebrating you all day long. We are going to thank you. We are standing together on Turtle Island to applaud you, not only for getting us through this time, but for what you do every day in challenging circumstances. If you wish to participate in a one-day celebration, thanking, supporting, and having a sneak peek at those who are going to get their Certified First Nation Health Manager designation from FNHMA, feel free to reach out to us. We need sponsors to help make this happen. If you want to provide a thank you, now's the time to partner with FNHMA to do so. So November 4th, don't miss it. We're going to have more information. I want to thank the board for taking a stand in making this decision and saying, we're going to do something big. We're going to say thank you, and it'll be November 4th. And if you want to participate, reach out to FNHMA. I'll be talking about it some more, but there's no time like now to hold up all of you front lines, and thank you. I just can't imagine how big this is going to be with everybody joining us. The other thing I wanted to mention is that mark November 3rd in your calendar as well. We're going to have an FNHMA webinar, and it'll be what we would have called a pre-conference workshop. And then for all of you FNHMA members, we'll host our annual general meeting on November the 5th. All right, you know what time it is now. It is time to give all the shout outs and thank yous. I do want to say a really special thanks to the team at Nation Talk and Indigenous Health Today. So that's ihtoday.ca. Stella, Dawn, Chris, thank you so much for getting us through. We couldn't do this without you. APTN, big heartfelt thank you. TELUS for providing the lines. Check us out every Thursday, including June 25th on Facebook at FNHMA, on APTN News, on the Wolf 95.7, Eagle Feather News, NCI FM Radio. Hey, Manitoba, it's great to chat with you every Thursday morning. CFWE, CKLB, CJWE, Element FM, Alberta Native News, Micmac Maliseet Native News, Co-op Radio, First Nations Drum, and of course, carrying us live on the radio is NCIFM, streaming all the time. We appreciate that. We're also rebroadcast on NBC, CKLB, Co-op Radio, and the Wolf 95.7. It's that time. We want to say thank you. Stay tuned.